We talked about this, Stu, when Obamacare was coming through, right? The complete live system.
Oh, yeah. That was a big focus of ours because it's a little scary that someone like this is behind your health care.
Correct. Someone like this is Dr. Ezekiel Emmanuel, and he's not ashamed of any of this stuff. He is how old? Like 65 or something, and he says his life is complete. He can die at any time now. Well, I got news for you. I hope I have another 40 years in me. What do you mean complete lives? You don't decide that. My God and me, I decide that with my God. But he thinks that, once you're over 50, you really start to lose production value and you become more and more of a useless eater. Also, when you're a baby at 0, up to about the age of 12, you're really kind of a useless eater. You're not putting anything into society. So if you get sick, we shouldn't put anything into saving that person because they're going to cost us way too much in resources or money or whatever it is. I warned you that this is what was mocked as death panels, that's what this meant. Well, those death panels are starting to come in. The Biden administration is prioritizing groups to administer health to black lives, brown lives, intersectional lives before other lives. This is rationing care, a.k.a. the complete live system, except it's not really on the value of anyone's life. It is a value of the intersections that you have had in your life, the troubles that you have had. This is some sort of repayment to you. We won't fix the white people. We'll fix the black people. They get priority. This is insane. This is absolutely insane. People think private healthcare, it's so unfair. Well, at least it's not based on something outside of yourself. When you can't get care because you're the wrong color, I don't care what color it is, it's wrong. It always has been. It was wrong when we were doing it for purely racist reasons back in the dark ages here of America, when a black couldn't go to a white hospital. We all know that was wrong. Well, now you're being turned around and turned away because you aren't the right kind of person that deserves this health care. Ezekiel Emmanuel has been teaching this complete live system at the University of Pennsylvania, and now American doctors are drawing the same conclusions, that the way Biden is handling corona care is very, very similar to the complete live system. There is an article from the Association of American Physicians and Surgeons that I would like to read just a couple of highlights from because it's pretty stunning. It's called Lethal Connections, Complete Lives Morphs into COVID Protocol in American Hospitals. In a shocking departure from traditional hospital policies, the hospital admissions have become like reporting to prison. Prisons and prisoners in American jails have more visitation rights than do COVID patients. One family member, a professional psychologist with a career focusing on victims of trauma, said that many hospital COVID patients are treated little better than animals. Shocking recordings of Mayo Clinic Scottsdale and Banner Health System hospital executives have been released by an attorney on the Legal Advisory Council of Truth for Health Foundation, an Arizona public charity. Executives were discussing coordinated efforts to restrict fluids and nutrition for hospital patients and to suppress all visitation to COVID patients. The COVID protocol that hospital physicians must follow in lockstep across the U.S. appears to be the implementation of the 2009-2010 Complete Live System developed by Dr. Ezekiel Emmanuel for rationing medical care for people older than 50. Dr. Ezekiel Emmanuel, who was the senior White House health policy advisor to Obama, has been advising President Joe Biden about COVID-19. as stated in his Lancet paper, blah, blah, blah. When implemented, the complete live system produces a priority curve on which individuals aged between 15 and 40 get the most substantial chance, whereas the youngest and oldest people get chances that are attenuated. Attenuated means rationed, restricted, or denied medical care that can lead to premature death. In 2021, whistleblower doctors, nurses, attorneys, patient advocates, and journalists have shown and exposed neglect of patients, denial of vital intravenous fluids and basic medicines to hospital COVID patients across the U.S. Now, this was an idea that started where else but in England with the UK National Health Service, which in effect, that health directive in the UK constituted euthanasia. That's exactly what is happening now here in the United States. We are starting to move down a very dangerous road. This is the left's brave new world, their great reset of healthcare, where your life will hang in the balance depending on what intersectional group you fit into. It's time to stand up. It's time to say no to this. The rest of the mainstream media will completely miss this or bury it. And it has a lot more to do than just mere pandering. They are moving us into the direction of the UK's NHS. And according to the doctor that wrote that AAPS article, the complete system actually originated in the 90s UK National Health Service Liverpool pathway. The author states, it is constituted euthanasia. And it is. And the minute we start going down this road, we are in real trouble. But it will help reduce the surplus population for global warming. It will help jobs. It will put out of misery all of those people who have lost their jobs and they're too old to retrain and would take too much money. All of these things. And if you think those things are crazy, read it in their own words. Why would you put the complete live system together? It's exactly the system that the Germans had. How many potatoes can you produce versus how many potatoes do you eat? If you could produce more potatoes than you eat, you get priority. If you produce less, you get none. That's the way it is.